my name is Emily. I'm going to be doing a physical assessment on you today. During this entire physical assessment, I'm going to be looking at your skin throughout. I'm going to be looking at the color, temperature, turgor, texture, moisture, lesions, scars, bruising, nevi, and edema. I'm going to start by looking at your head. I'm looking at the size, the shape, if it is symmetrical, and if it is midline, and it is. I'm going to palpate your head and your scalp. Is there any tenderness?
No.
Okay. And looking for any masses or lesions, any depressions, infestations. Also looking at the hair distribution, color, and texture, and everything looks good. I'm going to palpate your temporal arteries. Is there any tenderness?
No.
Okay. Palpate the TMJ. Any tenderness?
No.
Okay. Will you open up, close, and chin side to side? Good. Checking for any subluxation and crepitus, and there is none. I'm going to go ahead and palpate the lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. The lymph nodes are not palpable. There is no swelling or tenderness. And then going to do cranial nerve 5. If you will bite down. Good. Checking the masseter muscle. And close your eyes. We're going to check light sensation and tell me where this is.
Forehead, right cheek, nose, chin, left cheek.
Perfect. Cranial nerve 5 is intact. We're going to do cranial nerve 7. If you will smile, frown, puff out your cheeks, poke out your lips, and raise your eyebrows. Good. The face is symmetrical, so cranial nerve 7 is intact. And then going to move on to the ears. I'm going to look at the shape, the size, and the position. Everything looks good. I'm going to palpate the pinna and the tragus. Any tenderness?
No.
No tenderness and no masses. I'm going to look in the auditory canal. I'm looking at the tympanic membrane, seeing if it is translucent and pearly gray, and it is. There's no redness or swelling. I'm going to check cranial nerve 8. We're going to do the whisper test, so cover your ear and repeat after me.
1, 2, 3.
Okay, and the other side.
ABC.
Perfect. We're going to do the Weber test, checking for lateralization. Tell me, do you hear this more in one ear or the other, or if it is equal?
Equal.
Perfect. And we're going to do the Renee test. Tell me when you no longer hear this.
No.
Okay.
No.
Good. Other side.
No. No.
Good. Air conduction is greater than bone conduction. Then we're going to move on to the eyes. If you will remove your glasses. I'm looking at the eyelashes, the eyebrows, and the palpebral fissures, and everything looks good. Looking at the conjunctiva, which is white, and the sclera is pink and moist. There's no lesions or discharge. We're going to do cranial nerve 2. So if you will cover one eye and tell me the lowest line you can read.
LTFPH.
Good. And the other side.
LTFPH.
Good. And with both eyes.
LTFPH.
Good. That is checking gross visual acuity, central and peripheral vision. We'll go ahead and do peripheral vision now. If you will look at me and tell me when you see my finger.
No. No.
Perfect. Cranial nerve 2 is intact. We will do cranial nerve 3. We're going to check direct and consensual response to the pupillary response to light. So if you will look at my nose. Good. And we're going to go ahead and do accommodation and convergence as well. If you will look at my light, look at the wall, and look back at my light. Good. Cranial nerve 3 is intact. And now cranial nerves 3, 4, and 6 is checking conjugate gaze with the extraocular motion. So if you will follow my light with just your eyes. Good. That is intact as well. I'm going to go ahead and check the internal eye structures. I'm checking in for red reflex, and the internal eye structures are good, and red reflex is present in both eyes. Okay, I'm going to move on to the nose. I'm checking that it is midline and straight, and it is. We're going to check nasal patency, so if you will cover one nose and breathe in and out. Good, and do the other side. Perfect. I'm going to palpate the frontal and the maxillary sinuses. Any tenderness?
No.
Good. Okay, we're going to move on to the mouth. If you will open up. Raise your tongue. Good. We're checking the buccal mucosa, salivary ducts, the lips, teeth, gum, tongues, tonsils, palate, posterior pharynx, and the floor of the mouth, and it is pink and moist and everything looks good. I'm then going to check cranial nerves 9 and 10. If you will open and say ah. Good. The soft palate and the uvula raised symmetrically with phonation. And then cranial nerve 12. If you'll stick out your tongue. And do side to side. Good. The tongue is midline with no fasciculations. I'm then going to move on to the neck. We're going to check the trachea. You'll turn this direction, check the trachea, and then check the thyroid gland. We're going to move it to the right side and swallow, and then to the left side and swallow. Good. Everything is midline. And then going to palpate the carotid arteries. Good. Good. And they are 2+ bilaterally. I'm going to check for a bruit. There are no bruits. I'm then going to do the range of motion. So if you will flex, extend, hyperextend, lateral flex, and rotation. Good. And we're going to check cranial nerve 11. If you will shrug, perfect. And then we're going to move on to the posterior chest. So if you will face the squat. We're looking for any signs of respiratory distress, including use of accessory muscles, tripod positioning, nasal flaring, tachypnea, retractions, or cyanosis, and there is none. There's no obvious deformities, and everything looks symmetrical. So I'm going to go ahead and palpate the chest wall expansion. If you'll take a deep breath. Good. And tactile formitis, say 99.
99. 99. 99.
Good. Everything is symmetrical. And then going to percuss in the intercostal spaces. Good. I heard resonance throughout. I'm going to go ahead and auscultate, starting above the scapula. Take deep breaths for me. The lung sounds are clear bilaterally. I'm going to go ahead and do egophony. You will say E-E-E.
E-E-E. E-E-E. E-E-E. E-E-E. E-E-E. E-E-E.
Good. We're going to do bronchophony. If you will say 99.
99. 99. 99. 99. 99. 99.
Great. And we'll do whisper pectriloquy. If you will whisper 1, 2, 3.
1, 2, 3. 1, 2, 3.
Good. Everything is symmetrical and within normal limits. We're going to go ahead and do the anterior chest. So if you will turn around and face all the way this direction. Good. We're looking, there are no obvious deformities and everything is symmetrical. We're going to do chest wall expansion. If you will take a deep breath. Good. We're going to do tactile formitis. Say 99.
99. 99. 99.
Good. Everything is symmetrical. I'm going to go ahead and auscultate. Take deep breaths for me. Good. And lung sounds are clear bilaterally. I'm going to go ahead and move on to the heart. I'm going to auscultate first with the diaphragm. Each valve. So we have the aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border. Herb's point, third intercostal space, left sternal border. tricuspid valve, fourth intercostal space, left sternal border, and the mitral valve, fifth intercostal space, mid-clavicular line. I'm going to listen with the bell. Aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. I heard S1 and S2, no extra sounds or murmurs. I'm going to go ahead and feel for the point of maximal impulse, which is the fifth intercostal space, mid-clavicular line. And I'm going to go ahead and auscultate the apical pulse for a full minute. Noting the rate and the rhythm. Okay, I'm going to go ahead and have you lie down. I'm going to look for any jugular vein distension or pulsations at a 30 to 45 degree angle, and there are none. Everything looks good. I'm going to look for any heaves or lifts. There are none. I'm going to feel for a thrill in each auscultation point. The aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. There are no thrills. I'm going to go ahead and repeat my auscultation, starting with the diaphragm, aortic valve, pulmonic valve, Erb's point, tricuspid valve, the mitral valve, and again with the bell, aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. Again, I heard S1, S2, no murmurs and no extra sounds. I'm going to go ahead, whenever I'm doing this in a clinic, I will be doing everything underneath the shirt, but for today, I'm going to be doing everything over the shirt. I'm going to look at the abdomen and notice the contour. It is flat and symmetrical. I'm going to auscultate for bruits using the bell, the aorta, the renal arteries, the iliac arteries, and the femoral arteries. Okay. There are no bruits. I'm going to go ahead and auscultate valve sounds, starting in the right lower quadrant. Valve sounds are normoactive. I'm going to go ahead and percuss, listening for tympany, dullness, and flatness. Okay. Tympany is heard throughout. I'm going to go ahead and palpate. Is there any tenderness?
No.
There is no tenderness or masses. If you'll go ahead and hold your breath, I'm going to palpate the liver and the spleen. The liver is palpable and the spleen is not. Okay, if you'll go ahead and sit up facing this wall, we're going to check for CVA tenderness. Any tenderness?
No.
Perfect. Okay, you can face towards me again. We're going to start with doing the cerebellar coordination. So if you'll put your hands on your knees, we're going to do the hand flip-flop. Good. Put your finger on your nose and touch mine over and over again. Good. We're going to do finger serial opposition. Do it over and over again. Perfect. Cerebellar coordination is intact. We're going to go ahead and do light touch. So if you will close your eyes and tell me where this is.
Left arm, right hand, right arm, left hand.
Good. And we're going to do the lower extremities as well.
Right foot, left leg, right leg.
Perfect. And we're going to do the vibration sensation. So if you will tell me, do you feel this?
Yes.
Okay, other side.
Yes.
Okay, and we're going to do the lower extremities with the medial malleolus. Do you feel this?
Yes.
Okay,
Yes.
perfect. All right, if you will close your eyes and open your hands, we're going to do stereognosis. Can you tell me what this is?
Corn.
Okay.
Pin.
Perfect. And then we're keep your eyes closed and tell me what shape this is.
Circle. Triangle.
Perfect. Stereognosis and graphesthesia are intact. And during the upper and lower extremities, I'm going to be checking the skin for overall warmth and color, skin integrity, and edema through upper and lower extremities. I'm going to go ahead and feel for the radial pulses. They are 2+ bilaterally in the cap refill. Less than 3 seconds bilaterally. I'm going to feel for the dorsalis pedis pulses. 2+ bilaterally in the posterior tibial pulses. 2+ bilaterally again. And check for cap refill. Good. Less than 3 seconds bilaterally. I'm going to go ahead and check the joints of the fingers, the wrists, the elbows, and the shoulders. Checking for any redness, swelling, symmetry, deformities, nodules, tenderness, and crepitus, and there are none. I'm going to go ahead and do range of motion of your fingers. So if you will flex, extend, hyperextend, abduct together, abduct out, and thumb opposition. Good. And grasp my hands. Good. Straight hand grip is 5 out of 5. We can do our wrists. So if you will flex down, extend, hyperextend. Good. Ulnar deviation, radial deviation, rotation. Good. That is intact. And then elbows, flex, extend, hyperextend. Good. And we're going to check your strength, your bicep strength. So if you'll pull, good, and push, good. Strength is 5 out of 5 for bicep and tricep. We're going to do adduct and abduct strength for the shoulder. So if you'll hold your arms up, push against me, good. Pull against me, perfect. Strength is 5 out of 5 there as well. We're going to check range of motion for the shoulder. So if you will flex, extend, hyperextend, good. Internal rotation, external rotation, abduct out, adduct in, good, and then circumduct around in a circle, perfect. And then I'm going to move down to the lower extremities. I'm going to be checking the toes, the ankles, and the knees, joints for any redness, swelling, symmetry, tenderness, deformities, nodules, and crepitus. And there are none. Everything looks good. For your toes, I want you to flex, extend, hyperextend, abduct together, abduct out, and good. And then we're going to do your ankles. So if you will dorsiflex up, planar flex down, inversion, eversion, good, and rotation, perfect. I'm going to test your strength. So if you'll push up, good, push down, good. Dorsi and planar flex is 5 out of 5. We're going to check the strength of your knees. So if you will push out, good, pull in, good. Strength of the knees is 5 out of 5 as well. Okay, now I'm going to go ahead and have you stand up. You can see right here. Actually, I want you to sit back down. I'm sorry. We're going to check your reflexes. I'm going to do the brachioradialis. Okay. Bicep. Tricep. Okay. Other side. Brachioradialis. Bicep. And tricep. Okay. Then we're going to check your patellar. And your Achilles, and your Babinski. Okay, then we're going to do your patellar on this side. Bucks. Achilles, and your Babinski. Good. Babinski is negative, and all other deep tendon reflexes are 2+. Now I'm going to go ahead and have you stand up over on this side. You turn around. We're going to check your hips for any redness, swelling, tenderness, symmetry, deformities, nodules, crepitus, any of that, and it all looks good. There is none. We're going to check the range of motion of your knees. So if you will flex, extend, hyperextend, good. Other side, flex, extend, hyperextend, perfect. And we're going to do your hips. So if you will flex, extend, hyperextend back, internally rotate, externally rotate, abduct out, adduct across, and circumduct. Perfect. Other side. Flex, extend, hyperextend, internally rotate, externally rotate, abduct out, adduct across, and circumduct in a circle. Perfect. And everything, range of motion is intact. If you'll turn around, we're going to look at your spine. We're going to look at the curvature and the alignment. Is there any tenderness?
No.
No tenderness. Good. And if you will flex forward, we're going to look for any scoliosis. Everything looks straight. There is none. Good. We're going to do range of motion. So that's flexion, extend, hyperextend back, lateral flex to the sides. Good. And then rotation. Perfect. We're going to go ahead and do the Romberg. So if you will close your eyes, no swaying. Good. And then you're going to turn around. I want you to walk to the window. I'm checking the gait. Good. And if you will turn around and come back and do toe to heel, we're checking the tandem gait. Good. And if you will hop on one foot. Good. Hop on the other foot. Perfect. And this concludes our physical assessment.